Conjunctival melanosis, is this normal? So conjunctival melanosis really refers to increased pigmentation of the conjunctiva, and it can really range from benign physiological variants to pre-malignant or malignant lesions, and you really need to understand the difference and how to differentiate between them. And so the two most commonly encountered types are racial physiological melanosis, which is what we have in this patient, or primary acquired melanosis. So the racial melanosis, which is normal, occurs in individuals with darker skin tone. So this patient's Afro-Caribbean, and it typically occurs in early childhood, and it's usually bilateral, symmetric, has flat pigmentation, and this is most commonly found around the limbus or the interpalpebral conjunctiva. And that's exactly what you see here. It's happening around the limbus. And now the pigment is stable over time, and it's confined to the epithelial layer and has no risk of malignant transformation. So no treatments required. You may not even need to mention it, and you might want to document it. And if the patient asks about it, it's worthwhile giving the patient reassurance. Now, in contrast to this, primary acquired melanosis, PAM, that occurs later in life. It's more often found in middle-aged or older, fair-skinned individuals. Let's have a look at the other eye. By the way, look at the other eye, it's also in the limbus, and that's what I was talking to you about before. It's that bilateral, symmetric, flat, limbal pigmentation. So let's talk again about primary acquired melanosis. And so PAM is often unilateral and asymmetric rather than being bilateral and symmetric. It's flat and patchy, but it can be irregular and has indistinct borders, and it's acquired and not present since childhood, and it may actually progress with time. And so PAM can be with or without atypia, and without atypia has a very low risk of malignancy, but with atypia is pre-malignant and can have up to 50% risk of progressing to conjunctival melanoma. So how do you manage a patient with suspected PAM? The answer is you really have to document this over time with slit lamp imaging. Hey, look, we're on a slit lamp imaging YouTube channel. That's what you need to do. So it's very, very useful to measure this over time. And if you're worried that it is irregular, enlarging, involving the cornea or the fornices or associated even with feeder vessels or nodularity, the answer is a biopsy. And so PAM with atypia, if that's atypia is shown on biopsy, you may need to perform an excisional biopsy, cryotherapy, and you may even want to consider topical chemotherapy. So the takeaway for you guys is consider the laterality, the onset, the evolution, the pattern, the patient's demographics, and if you're worried, take slit lamp photos. Hope you found this video really useful. It's a bit longer than normal, but I hope you enjoyed this. Let me know if you found that commentary useful.